CHWs are a critical member of our healthcare team. They have shared lived experience with our patients. They have a trusted relationship, which oftentimes members of the healthcare team do not have with the community. And they can help patients navigate the healthcare system. They can share information in the language and in the way that is best received by individuals. One key component that we typically don't go into in the healthcare setting is in an individual's home. And community health workers, especially at Grady, one of the key differentiators is that they're doing home visitation with patients.
The more our team can be in the community settings, making sure that we increase that education and awareness, is the more likely that by the time somebody comes in for a screening or any type of clinical or medical assessment, that it's happening earlier, which we all know will lead to better outcomes.
Not having the financial means to get my first mammogram really led me to realize that there are services out there and there is help out there. I always had everything I needed, but due to a life change that I was unaware of, it really put me in a whole different situation in my life where I would never have thought that I would be in a position to need assistance like that. But I ended up needing that assistance, and it ended up, I credit it to helping save my life.
This role is a key component to the community. Without community health workers, community health advocates, how are patients getting the services or knowing the services that are being provided at health systems? How are patients getting to where they need to go? Community health workers, advocates go to where the patients are. The hospital standalone doesn't move, but community health workers do.
I'm a community health worker at Mercy Care. In partnership with Grady, we're part of the Community Resource Hub. With the Community Resource Hub, we assist clients with either uncontrolled diabetes or hypertension, and we provide them with health education and possibly a blood pressure cuff to educate them on how to use their blood pressure cuff, as well as techniques on how to lower and manage their blood sugar. These interventions are helpful for the client because it helps to ensure that they lower their A1C or their blood pressure so they won't have to return back to the hospital. So by having these interventions, this helps us to bridge that gap in between so they're able to put their health first.
I partner with other, like school district, Department of Labor, and we go out to the, to the fields. We go out to the farm workers, and we inform them of the services that are offered, from my service and from their service. So, and I distribute brochures, with the information of the services, like, for example, diabetes, high blood pressure, just basically the services that are offered at our health department.
I work for Grady Hospital at the Ivy with the Ivy team. And what I bring to the situation is I'm a gunshot wound survivor. Violence intervention work is a relatively new field, but it's expanding all over the country.
I do trainings across the nation. I help get a lot of CBVI organizations started, and CBVI is a community-based violent interruption organization. I help them get started from all the way to St. Louis, all the way down to New Orleans. I just recently came from New Orleans. Just training them on community-based violent interruption and being able to have them a standpoint of professional development inside the work. Also training violent intervention specialists inside the hospital. The key word in the phrase is community. So a person from the community has to be a community health worker.
Hospitals are ground zero for violence prevention. When you get injured, you come to a hospital. And so our program is set up to support those patients to make sure that they're not returning with subsequent violent injuries, that they are given the opportunity to heal, to thrive, to pursue the things that they're interested in life. And so our main goal is to make sure that they have the support to do that.
Because of the CHW's often shared experience with our patient population, they know exactly what an individual needs to receive the right health education and learn how to advocate for themselves in a healthcare environment. And providing that support allows individuals in our community to achieve better health outcomes.
Do you know your community health worker? To learn more, call 404-413-0198 or visit www.gachw.org. If you're currently doing community health work, you can help strengthen the infrastructure of the workforce by taking this brief 5-minute survey. Scan here to be counted.